Lorena to start the recording. Welcome everyone to the first session of the Person-Centered Care Certification Virtual Prep Course. My name is Sarah Guastello, and I will be leading you through this 4-week course along with my colleague, Christy Davies, who you will momentarily. I have been involved with the certification program for the past 11 years since its inception, and have developed this course in order to support all of you in the process of achieving excellence in person-centered care within your organizations and using the person-centered care certification framework to do so. So first I want to note that this is the most registered for course, virtual prep course that we have held, and we've been holding this course for several years. And I just take that as such a positive signal about how person-centered care concepts have been embraced all over the world. I'm really happy to welcome you all to this course today. The program is being offered by Plaintree. If you're not familiar with Plaintree, we are an organization, a not-for-profit organization that partners with healthcare organizations around the world to provide a construct for person-centered excellence. And that construct is really represented most clearly through the Person-Centered Care Certification Program. So that's what we're going to be spending the next 4 weeks together examining. So I said that we work with organizations all over the world. That's certainly reflected in who we have with us taking this prep course this time around. We actually have, by last count, I have to pull out my list, we have people joining from at least 14 different countries, which is really exciting. So we've got folks from Australia and Canada and Chile and Egypt and Israel and Lebanon and Peru and Qatar and Saudi Arabia and Sudan and Tajikistan and Turkey and the United Arab Emirates and the United States of America. So I just think that's amazing that we're all coming together around this concept of improving healthcare by really focusing on person-centered care. So welcome to all of you. I know we don't necessarily have representation from all those countries on this call live, because as you know, we also record these sessions. So folks for whom it is a less humane hour have the opportunity to listen to the recording at a time that's most convenient to them. So at this point, I wanted to sort of welcome you all in person, but I am going to go off camera just to save on bandwidth. And Lorraine is also going to turn down the video for the rest of the participants as well. But I mentioned my name, Sarah Guastello. I'm joining from Connecticut. That's where Plaintree International's headquarters is. My colleague, Christy Davies, is with us as well. Christy's been working on the certification program for the past 8 years and is really sort of your first line of support for any questions related to certification. We're very much a team. You're going to see that over the course of the next 4 weeks, where one of us will take the lead on sort of the lecture part of the course and the other will be in the background answering questions over chat, which is a good opportunity for me to let you know that there is a chat function, which I see some of you are using. Christy and Lorena are actually managing that chat. So if you have any questions related to the content that we're covering about the certification program, please forward those directly to Christy Davies in the chat, and you can see how her name is spelled. And anything that's related to a technical issue with the webinar, you would send, or to registration or accessing the course community, you will send that to Lorena Bedoya. So, full disclosure, we're going to have a lot of content to get through over the next 4 weeks. So these sessions here, and it's why we sort of mute everyone on entry, these are less interactive. It's much more of a lecture during these 4 one-hour sessions. So there's not going to be a whole lot of interaction over the phone, but we invite you to take full advantage of that chat, and we'll be compiling all the questions that come through during the sessions, and we'll answer them at some point in some way during the next 4 weeks. So please take full advantage of that chat. But there's also other ways for us to be interacting, and I'll share a little bit more about that in a moment. Before we move on, I did want to establish a few expectations for the next 4 weeks. First off, to clarify, this is not a person-centered care implementation course per se. So we will, of course, be identifying key strategic and tactical activities that will position your organization to develop and maintain a person-centered culture. But the real emphasis here is more the nuts and bolts of certification. So if you're looking for sort of your organization's specific kind of roadmap, this is more of a general look at the certification program and how that framework was developed and how it supports organizations in achieving person-centered excellence. I should also note that we will be focusing on the organizational certification for healthcare settings. So to clarify, we are not covering the individual certification or the higher education certification that was piloted last year. Both of those efforts are under development, and they remain at this point in time outside of the scope of what we're covering in this course. So if you have specific questions about either of those, you can certainly reach out to me, but we won't be covering that during this particular course. In terms of this course structure, as you know, we'll have these 4 weeks together, and once a week there'll be these weekly online classes, as well as an opportunity for discussion and Q&A, or answering your questions on a course community on My Planetree. So we're going to spend a little bit of time today with me orienting you to how to use that course community. All of you have been or will be given access to that course community. So I'll talk to you more about that in a moment. Within that course community is where you'll be able to access various resources that support what we talk about during these lectures. It's also where we will upload the recordings of these sessions for on-demand use. So if you miss one and you want to catch it the next day or over the weekend, you'll be able to go to the course community and download that. You're also welcome to share those with your colleagues as well. That is also the location of, it'll sort of be a central clearinghouse for all the questions and answers that we may not be able to get to during the 1-hour sessions once a week. So if you've got questions that you asked over the chat and we didn't get a chance to answer it by the end of the session, we will bring that question to the course community and answer it there. You can also post questions directly to the course community, and either Christy or myself who will be monitoring it will respond, so that it's not only you who's getting the benefit of the answer to that question, but everyone who's participating in the course. Because we have found time and time again that if a question comes up from one person, it's probably a question that's brewing in someone else's mind as well. So this enables us to really spread that knowledge. And then finally, at the end of the course, there will be a completion quiz. So it'll be a brief quiz that covers concepts that we went over the course of the 4 weeks, and everyone who completes that exam, it'll be an online exam, will receive a certificate of completion. So let's walk through the course community really quickly. So you will go to myplanetree.org. Many of you have already received an email from me that included a link to this course community, so you could just click onto that link. You're then going to log in. You will be logging in using the same username and password that you created to register for the class. Or you may have already had one if you're a Planetree member and have already accessed My Planetree. But you will need to log in with that username and password. And then you'll see this, and you'll want to go to the tab that says Communities. And you're going to click down and select My Communities. And when you select My Communities, June 2018 Person-Centered Care Certification Prep Course Community will come up for you. So you will click into that. And you will see something that looks like this. So you see latest discussion posts. That's where I will post potentially messages to to everyone taking, all the participants. It's where you also can post your questions, and then Christy or myself would respond to your questions right within this course community. You also see here latest shared files. Christy and myself will be uploading over the course of the next four weeks, again, resources, tools that you can use. You'll also get the full slide deck for each of the weeks, as well as the recording for each of these weeks in that latest shared file, that latest shared files window. So one of the resources that's already populated, and I did pre-populate with a number of tools for you, but one of them is the Person-Centered Care Certification Program. And this is going to be, I assure you, your go-to resource as your organization pursues person-centered care certification. Everything we cover in this course is also covered in the manual. And so some folks find it helpful to download it and have it sort of open and maybe even print it during the course so you can take notes directly in the manual. But we didn't want to go too far into the course before letting you know that this exists. It includes background on the program. It includes an overview of the process. It includes all the criteria with some guidance and clarifications for you, and also gives you a preview of what you will see in the online application for certification. So that tool is available for you to download as soon as you are able. So in terms of what we're going to cover in the next 4 weeks, we will take a look at why the certification program exists and how it helps organizations in their efforts to excel in person-centered care. We'll take a look at the nuts and bolts of the framework itself and how that was constructed based on sort of the scientific evidence base around person-centered care and person and family engagement, as well as our experience running this program for 11 years. We will look at the steps to pursuing certification step by step and answer those questions. And then we'll spend 2 full weeks doing a deep dive into the criteria, looking at every one of the 26 criteria and giving you hopefully a better comfort level and confidence that you understand sort of the spirit and intent behind all of those. And throughout all of this content, we'll be identifying helpful resources that are available to you. So this is the week by week breakdown. We're going to focus today on looking at the performance framework a little bit more generally. Next week, Chris, the pathway to certification, and then we'll get into the criteria in week 3 and week 4. So I want to make a note as well, because since we do have so many folks participating in the course this time around, there is a mix of individuals and teams who are completely new to person-centered care certification. And there's a number of you, however, who are familiar with the previous iteration, the Plane Tree Designation Program. And so we want to make sure that this course is equally useful regardless of the amount of previous exposure or experience you have with the Plane Tree Recognition Program. So for those of you who have had experience with the Plane Tree Designation Program, I'm going to do my very best to help you guys connect the dots between sort of the program you're familiar with and the recently redesigned program that was just launched earlier this year. But speaking of changes, as part of that program redesign, which really went into effect, or which really occurred, I should say, over the last 2 years, we've introduced a new name to the program. So for those of you for whom this is completely new, it will always be the Person-Centered Care Certification Program to you. But for many of you, you are accustomed to the Patient-Centered Designation Program. We have now shifted to this new language of person-centered certification. Person-centered because it's a more inclusive term than patient-centered. So person-centered not only captures patients, but long-term care residents and family members and staff. But in addition to that, by adopting the term person-centered, we are aiming to signal the program's emphasis on personalized and individualized care. Care that takes into consideration not only an individual's medical condition and experiences within the healthcare system as a quote-unquote patient, but all the other things that make them a unique person. So really looking at the social determinants of health that lie outside of the healthcare interaction, but are so influential on a person's health and their well-being and their overall quality of life. We've also found that the term certification is more widely and globally understood. So that's why the shift from designation to certification. Along with this new name, we've also adopted a new look to the certification badges that you can see here. And based on some of the feedback we've received over the years, one thing we wanted to make sure we did was that we adopted badges and a look to this program that conveys clearly and communicates what this achievement really stands for. And so, as you can see in these badges, we're focusing on excellence in person-centered care, but then through those words that surround the Plaintree logo, quality, partnership, and compassion, we're giving you a little more context. When I say you, it's not really meant for you, because you all know you are doing this work, but for people in your community and patients and family members and clients who come into your healthcare systems, they may not be familiar with that term person-centered care. What does it mean to achieve excellence in person-centered care? So we wanted this badge to concisely convey that what that means is excellence in quality, in partnership, and compassion. So what is person-centered care certification in a nutshell? For some of you, this is a little bit of a refresher, and for some of you, as I said, this will be new information. But essentially what the person-centered care certification program is recognition for excellence in person-centered care that represents the highest mark of achievement for creating an organizational culture of, to borrow the words from the badge, quality, compassion, and partnership. But it's more than a recognition program. It's more than a mark of excellence and a badge for organizations to hang on their walls or put on their letterhead. First and foremost, it is a structured pathway for organizations to use to provide that sort of operational structure to this effort to achieve excellence in person-centered care. So it's organized around 5 drivers and 26 criteria that work together to really create that roadmap of what it takes to establish the systems and processes necessary to sustain culture change across an organization. And there are 3 key elements that really make this program unique. And I want to just call those out for you. So this is an evidence-based program. It does draw very heavily on what the literature tells us and the scientific evidence tells us about patient and family engagement in person-centered care. And I'll get into that in a little bit. But it also draws very heavily on what we call the experience base. So the experience base is what real people in real life circumstances interacting with the healthcare system experience. It's based on what patients and family members around the world have told us in focus groups for many years, decades in fact, what they have told us matters most to them about their healthcare experiences and how they define quality in healthcare. So the origins of this program, since its very beginning, over 11 years ago, are the voices of patients and family members. So the criteria, the framework, all of that draw directly from what we hear from these key stakeholders in the healthcare system. So that's why you're going to see embedded throughout the certification program things like an emphasis on compassion, on honoring patients' preferences and values, on involving family as members of the care team, because these are all elements that largely fall outside of the scope of most accreditation and recognition programs. But for a program that focuses on what matters most to patients, of course, it's not surprising that these sorts of things would rise to the top. So we have engaged patients in the development and in the redesign of this program in several ways. We had patient and family advisors serving on the work group that really oversaw the development of the initial program as well as this most recent reboot effort. And we involve patient and family advisors on the certification committee, which is the group that ultimately confers certification. But in addition to that, when we come on site to each of your organizations to validate that you are, in fact, sort of meeting these standards for person-centered excellence, it's not two people from Plaintree who are making those evaluations. We are facilitating conversations with your patients, with their family members, with your clients, with your staff, because they are ultimately the arbiters of whether or not your organization has achieved excellence in person-centered care. So no organization has achieved certification without their patients and family members attesting to the fact that what they have experienced aligns with what they would consider to be person-centered care. And we work that way, involving patients at every step of this program, not only because we think it's the right thing to do, and we certainly want to model that level of collaboration, but also because we know that it makes this program all the stronger, and it makes this recognition far more meaningful for the organizations who go through this process. So that's the first sort of differentiator. The second is that there's a very strong emphasis on the staff experience, right? So it's organized around the undisputable fact that the only way to deliver on the promise of person-centered care for patients is to address the staff experience. So we've got a number of criteria that are related to the staff experience. And then finally, and I've touched on this already, unlike other recognition programs that are often validated primarily through documentation, so an application or you're providing example and screenshots, we feel that a recognition essentially around the patient experience has to be based on the experiences of real patients that you have worked with. So that's why ultimate certification is conferred based on those discussions with patients, with family members, with staff, with residents in long-term care communities, as well as observation. And also some sort of spontaneous. So there's focus groups, which brings together a group of recent patients or family members to talk about their experiences as a group. And then we'll also do more spontaneous interviews and chat with folks as they're waiting in waiting rooms or in your clinics. And Christy's going to talk more about that process. It is definitely one of the things that makes the certification program so unique is the level of the way that we validate based on, again, the lived experience. Okay, so why do organizations pursue certification? Sort of what's in it for you? Before I go any farther, I do want to issue this disclaimer because I think it's too easy for really committed healthcare professionals to misinterpret person-centered care improvement efforts as a personal flaw. So I don't want anyone to misinterpret why we're here. We think that any team who's interested in getting better, any team that sees this certification program as something that could sort of distinguish their organization is filled with healthcare professionals who are each deeply committed to providing the best possible care for their patients and being good colleagues to their coworkers. But we also understand how challenging it can be for people to remain present and compassionate and culturally sensitive and to communicate effectively and to personalize care and engage patients and family members in decision-making and care planning every patient, every time. And to do that while you're also maintaining your productivity and being cost-effective. So through the certification program and through this organized framework, what we aim to do is to support individuals in not only preserving sort of that personal commitment to person-centered care, but also to strengthen the broader organizational culture of person-centered care by implementing structures and practices that support a more systemic approach to person-centeredness. And that's just to address the reality that there's often a gap between what we aim to do and what we're actually able to do consistently and reliably every day or every night. And by the way, I would say, again, we work with organizations across the world. I think these gaps, this common realization, is universal. And so why certification? Getting back to that initial question, because it provides a roadmap for essentially taking on this challenge, for setting up structures and systems and processes and trainings to make a respectful, personalized, responsive, convenient, compassionate patient experience the norm, and to really close that gap between the best of intentions at a personal level and what is actually able to be achieved at an organizational level, again, systemically. And that roadmap that I just talked about is really based on three things. It's based on evidence, starting right in the middle, because we know that the key to enhancing receptivity to these concepts is evidence that adopting these approaches, evidence that changing business as usual will drive different results. And so the certification standards are backed up by a growing body of literature that demonstrates how these elements of person-centered care work together to drive outcomes related to better culture, better care, better health, and lower costs. So we start in the middle. We need evidence. And then there needs to be a framework or a logical way of thinking about implementation. I'm going to walk you through that today. And then finally, actionable strategies. So taking that big concept of person-centered care and making it operational or converting it into a strategy that can be executed on. To the measurable elements, you'll become familiar with this terminology, I promise you. That's the criteria and the measurable elements really lay out those actionable strategies for you. So let's take a look at the framework itself. This is it. And what you see is what it takes to achieve the aim of improving quality, patient loyalty, and by a continuously learning person-centered organizational culture driven by the voice of patients. So the framework centers on 5 drivers, which you see in those big boxes sort of in the middle. Drivers really boil down what it takes to create that kind of culture. And this is a more action-oriented improvement type model organized around 5 drivers of improvement that we believe are immediately relevant to any organization pursuing person-centered excellence. So for those of you who have some familiarity with the earlier iteration of the program, the patient-centered designation program, we had previously organized the criteria in buckets that were organized around the plane tree components. These are the new buckets. So this is the way that we are organizing all of the criteria again, and we think that this way of tackling this, looking at organizational structures that promote engagement, connections between values, strategies, and actions, implementation of practices that partnership, knowing what matters, and using evidence to drive improvement makes sense for any organization, regardless of the approach or model that they're using to implement these sorts of changes. So for each of those 5 drivers, there are between 4 and 7 secondary drivers. So those are in the lighter boxes to the right. And what they do is kind of drill down into the driver. And they're more operational. Those are the criteria, and there's 26 criteria. So that's the framework for you. We're going to be spending a lot of time over the next 4 weeks digging into it, but I wanted you to see it all sort of in one place at one time. This is just another way of looking at it. For those of you who've been working with the designation criteria for a long time, you know that we were never before able to fit all of the criteria on one slide. We went from 66 criteria to now 26. So I wanted just to talk a little bit about the consolidation of the criteria. The 66 criteria that we previously had were very comprehensive. And I think for any of you who are familiar with them, I would expect that you'd probably agree with that statement. Perhaps you'd also agree with me that maybe we're too comprehensive, because if you have 66 criteria to meet, 66 standards that you're being held to, that can be really overwhelming. And when you use a list of 66 standards that are all equally weighted, which they were, it can be very difficult to understand sort of where to start, how to prioritize this long sort of to-do list, and where to really focus your attention. So that's one of the reasons we wanted to undertake this effort a few years ago to consolidate the criteria and take a look at the framework in general. The fact that in the earlier set, all of those 66 were weighted equally also suggested that each of them were equally impactful on the culture change effort, and that simply wasn't the case. Some were definitely more foundational and key to the long-term sustainability of the effort, and some sort of needed to be in place in order to launch an organization to the next level. You kind of needed to start with the basics and then work your way up. But again, they were all equally weighted, so that wasn't really clear in the way that the earlier program was set up. So our goal with the consolidation down to 26 criteria was to help you narrow in on the most high leverage changes. Now, how did we know what the most high leverage changes were? First, we consulted the evidence base, and then we looked at the experiences of high-performing sites that had been doing to look for patterns and trends. Now, having said that, when we did the consolidation, there were still a few significant gaps around patient and family engagement and population health. And so we did add in a couple of additional criteria that don't match up directly to criteria in the earlier set. So we're not going to talk about the criteria in any depth today, but I did want to at least get them on the screen so you guys can see them. The full criteria set is in the program manual we talked about, and it's also, you can just download the criteria there in the course community as well. Now, if you do the math from the earlier set criteria to the newly adopted set of 26, it would seem like we retired 40 criteria. That's actually not the case, because we did a lot more consolidating than we did deleting entirely. So that's why I wanted to pull up sort of these shorthand versions of the criteria, because for those of you who have experience with the earlier patient-centered designation program, these criteria will feel, I believe, very familiar to you. Because we technically lost very little of the spirit and intent of the criteria that were retired. Rather, we just sort of embedded them into these new criteria in different ways. For instance, we consolidated many criteria related to the healing environment into one criteria in this new set that specifically focuses on ways that the healing environment promotes patient and family engagement. That's just one example of the consolidation. And so even though we reduced the number of criteria substantially, I really feel that we gained so much more than we lost, because this new set, I think, offers up a much more direct route to person-centered excellence. And because it's more direct, it's going to accelerate your ability to drive the change. So there was a lot that went into the evolution of the criteria, and specifically that consolidation. And I mentioned that we consulted the evidence base, and this is the National Academy of Medicine's guiding framework for patient and family engaged care. Plaintree collaborated on this with the National Academy of Medicine. We actually chaired the group that put this evidence-based framework together. And so this ended up being a key source for us, because this effort included compiling a comprehensive bibliography of current scientific research in support of these different elements of patient and family engaged care, and specifically how those elements work together, how the right structures, practices, and connections work together to improve outcomes. You see over to the far right, related to better culture, better care, lower costs, and better health. So the reconfigured certification program really maps now directly to this evidence-based framework. So I have a link here for where you can go. There's a big discussion paper about this effort and about this guiding framework. And I included a link on the slide, but I also uploaded the whole paper to the course community, so you can download that there as well. So that brings us to the drivers. Again, this is the organizing structure. These 5 drivers are the buckets that all of the criteria are organized around. And it's a high-level depiction of what it takes to create this kind of culture, a culture where you're achieving excellence in quality, partnership, and compassion, or person-centered care. So the 5 drivers, they are intentionally sort of depicted this way. They all need to be in place, all support each other to create this culture. There isn't a hierarchy among the drivers themselves. And while the criteria within the drivers are weighted differently, each of the drivers is actually weighted the same. We'll talk more about sort of how the scoring and the points associated with this program work next week. But just know the drivers are all in fact created equal. So just to walk through them with you. The first driver is create organizational structures that promote engagement. So in this driver, we're looking at the organizational and physical structures that break down barriers, whether they be literal barriers or figurative barriers, between healthcare professionals and patients and families. So within this driver, the criteria look at your person-centered care steering teams and work teams, and how do those bring to bear the perspectives of frontline staff and leadership, as well as patients and family members. How are they breaking down silos? We look at human resources systems. We look at the built environment and staffing of your person-centered care efforts. The next driver is connect value, strategies, and actions. So in other words, creating cohesion between what you do, so behaviors, the tasks, the activities, and why we do it. Your values, your mission. So within this driver, we look at leadership practices. We look at integration of person-centered care within your organization's strategic plan. And we look at how you are supporting staff and feeling connected to a deeper sense of purpose to their work and a shared sense of purpose that sort of brings everybody together. Regardless of their role within the organization, they all know that they're working toward this common goal. Driver number 3 is implement practices that promote partnership. So these are the practices that bring that commitment to person-centered care to the bedside, to the exam room, to the consultation space. It's where it really plays out in your interactions with patients and family members. So there are 7 practices. And again, how those practices, how the intent of these practices is applied may differ based on the setting of care. So what I have not mentioned is that this program is applicable across the full continuum of care. So we have certified organizations. We've certified acute care hospitals, behavioral health hospitals, hospice, long-term care, physician offices, ambulatory cancer centers, and other outpatient settings. The intent, the spirit and intent of the criteria remain the same across all of those settings. However, how they are actually carried out and what it may look like from a practical or operational standpoint may vary based on the setting. But when it comes to implementing practices that promote partnership, we look at practices around, for instance, sharing a patient's real-time personal healthcare information with them, how family members are involved to be active participants on the care team, how communication among the care team is adjusted to maximize opportunities for patient and family input and be part of those discussions. Again, what that looks like depending on your setting may vary, but the intent is the same. Settings. The next driver is know what matters. So what do we mean by that? That means providing care that's personalized according to individual needs, preference based on what we call partnered determination of goals. So really understanding what matters most to the patient and ensuring that care plans reflect that. Within this driver, we cover passion practices, shared decision-making, and personalized care. And then the final driver is use evidence to drive improvement. So that's looking at your organization's capacity to create measurable change. So those are the 5 drivers. As we look at the criteria in weeks 3 and 4, we'll do a refresh on what each of these drivers, sort of the themes behind each of these drivers, and help you to understand how the criteria within the drivers connect back to the overall intent of that driver. So, I said that this certification program maps to the National Academy of Medicine's guiding framework for patient and family engaged care, and I wanted to demonstrate how that's the case as we look at the drivers. So driver 1 is create organizational structures that promote engagement, and that maps directly to the structures strategic input box on the National Academy of Medicine guiding framework. Driver 2 is connect value, strategies, and actions. That maps to connections. Driver 3, implement practices that promote partnership. That maps to partnership. Driver 4 is know what matters. That maps to co-design. And then finally, driver 5 is use evidence to drive improvement, which maps to this continuous feedback loop. And what the National Academy of Medicine guiding framework demonstrates is how all of these things work when you combine them, when they work together and build off each other, work to drive improvement in those outcomes. And so similarly, that's what we expect from organizations that use the certification for their person-centered care efforts. So I'm going to talk again to folks who are have more experience who've been working with Planetree over the last several years. I know that these drivers may take some getting used to for you, especially since you're accustomed to thinking about the criteria as they relate to the Planetree components. So I wanted to just be very explicit and answer a question that I'm sure is on many of your minds, and that is that the components are not being retired. Remain the foundation of the Planetree approach to patient or person-centered care. But I like to think about the components as representing the what of person-centered care. So in other words, what patients and family members and staff can expect from an organization with a person-centered culture. So compassionate human interactions, access to information, the involvement of family and friends. Those are all the components. The drivers, though, on the left depict the how to build and sustain an organizational culture where those components on the right come to life. So by creating organizational structures that promote engagement, by connecting values and strategies and actions, by implementing practices that promote partnership, by knowing what matters, and by using evidence to drive improvement. So the drivers do not replace the components, but they do work together to depict both the what and the how of person-centered care. So I wanted to just put up this crosswalk for those of you who have been working with the components for some time, just to show you how they sort of match up and just underscore that we have not completely abandoned what you know, but really does sort of support implementation of those components. So that's the framework, the performance framework for the person-centered care certification program. Next week, we're going to talk much more about the operations of the program itself before we get into the content in weeks 3 and 4 of the criteria. But to sort of tee up next week's conversation, and as a refresh of today's conversation, I want to just introduce the program elements. So we start with the 5 drivers, which we've now gone over in some depth. That's the highest level depiction of what it takes to create this culture to achieve that aim. From the 5 drivers, we drill down into 26 criteria. Those become more operational, and they sort of get at the spirit. What we didn't talk about, and we'll talk about this week, are the measurable elements. So here we're moving from sort of the spirit and intent into specific actions, tactics, and strategies. And these measurable elements, there's 107 of them, as you can see, they're also the basis for how your performance against the criteria is evaluated. So not only do they provide some sort of operational guidance to you, they outline for you how your organization will be evaluated. What are the specific elements you are going to be measured against, hence the name. Each of those measurable elements is associated with a point value. So this is a new part of this redesigned program. It's different, and for those of you who've gone through designation in the past, this may take some getting used to. But the award of certification and the level of certification that's awarded, gold, silver, or bronze, is based on the total number of points earned by your organization. So again, I am just kind of previewing what Christy is going to talk about in much more depth to you, next week when she introduces the evaluation methodology. But that's what we'll be talking about. About these 4 weeks, I'm also going to be highlighting different resources that could be valuable for you. This is one. If you've not yet been to certification.planetree.org, I encourage and invite you to do so. This is sort of the central hub of the certification program in terms of providing the information you may need about the program. There's resources there for you as well. Among the resources, you can access the online application, which Christy will be talking to you about next week. The program manual is there, although you can also access that on the course community. The criteria is there. There's sort of some infographics about the benefits of certification, about the step-by-step process of pursuing certification. There's a nice little ebook on the top 10 best practices in person-centered care, and there's a number of case studies as well. So if you've not been there, I encourage you to go. To find these resources, you'll just click on the resources link. Also, on the certification.planetree.org site, you can see a video which answers the question, why Planetree, or why certification? I gave you some insight into that today, I hope, but I think it's probably much more valuable for you to hear it from organizations and teams that have gone through this process. So I wanted to end today's session with a video where you can hear directly from them. And I've also uploaded this video to the course community if any of you wanted to share it with others in your organization.
The only way that we can be successful in healthcare these days is really to work together with patients, families, anyone who comes through our doors, and offer that person-centered experience to them. And that's what they're looking for, that collaboration, the working together, the partnering.
As we look at how we deliver person-centered care, there's so many opportunities to improve, and we are always looking for best practices, partners, people to share information with.
We were looking for something that validated all of the work that we had done as far as patient and family-centered care. And when we looked out there, we found Planetree.
The Planetree certification program resonated with us. We look at it as a highway to success. Because if you try to imagine what patient-centered care is from your own perspective, you may be off the mark.
For us, we were looking for a framework to structure our effort. So when we saw that model of care or model of Planetree, we've been really amazed about how this model can help us.
Planetree teaches us about communication with each other, with patients, with families. Planetree teaches us about how to engage patients in their care, which is so critical for our success.
For us, the reason to pursue a roadmap that is pretty intense by going through the Plaintree certification was really to take a look at the organization and see where our opportunities are to be better.
Our patient experience scores increased dramatically. We are now routinely above the 90th percentile. We've been able to maintain those results over time, which is very exciting.
We've been really successful in reducing the turnover and increasing the staff engagement and staff satisfaction.
Hospitals should pursue Plaintree certification, not only for their community, but also for themselves, for their staff, and for their growth.
We have much higher employee engagement results. We have much higher patient experience scores that I think are due in large part to our Plaintree journey. It's been worth every minute and every dollar.
I wouldn't change 1 minute, 1 hour, 1 day of time that was put into this journey together. It is so worth it.
Partnering with Plaintree is the right thing to do. No matter what service line, no matter what sort of patient population you serve.
You have changed the lives of thousands and thousands and thousands of people.
We are so proud and honored to be affiliated with them and to have worked with them. And we can't wait for their recertification process.
Well, I hope that ends today's session with a little boost of inspiration and encouragement in terms of what we'd encourage you to do between now and next week's session, same time next week, would be to download the certification manual and start posting any questions that you have to the course community on My Plaintree. Take full advantage of it. It's one of the valuable aspects of this course. It's having the opportunity to use us as resources to answer questions that come up during the course itself. So we have just a couple of minutes. I'm going to open up the chat and see if, from Christy, if there were any questions that came through that we can answer in the last couple of minutes.
Sarah. Most of the questions were just sort of technical related, but there were a few about the and the slides being available in the course community. Obviously, everyone really wants to have the ability to access these slides and this content, and rest assured, all of these documents and the recording of the session will be available in the My Plaintree course community.
Great, thanks, Christy. And I will also just let you know, I will always post the slides for that week's session a couple days before the actual session. So for those of you who like to follow along and take notes on the slides themselves, you will be able to go into the course community in advance of the session and download them at that time. A question came in, how to download the certification manual. So you will go to the course community. It's at myplaintree.org. You'll need to log in using the username and password that you used to register for this course. You'll log in, you'll go to communities on the navigation bar. You'll select My Communities, and the community for the June 2018 Person-Centered Care Certification Prep course will pop up. And from there, you will go to the library, and within the library, you will see the Person-Centered Care Certification Program Manual. And that is the same place as well where you can post your questions. So in the discussion box, I'm just looking at the group chat, that question came in. When you go to My Plaintree, in the discussion box is where you would post any questions that you have. And I should note, we will to the full group when the questions are not site specific. If it's a site specific question, meaning it is a very particular circumstance that your organization is experiencing and it may likely not be relevant to others within the course community, then we may just send you a personal email. But by and large, our hope is that we can respond to most of the questions to the full group, so everyone benefits from that sharing of information. All right, everyone, thank you very much. We look forward to spending the next few weeks going through all of this content with you and getting you guys prepared to go on this person-centered care certification journey with us. Thanks so much. Bye-bye.